Hello, everybody. I think I just see all of us, correct? So nobody else yet? Nope, there's more. Got it. You're good to go, Sean? Hey, good afternoon, everybody. Thanks for joining us. My name is Peggy Green. I am the Executive Director of Iron County Care and Share in Cedar City, Utah. And we are in the Iron County LHCC, which is Iron, Beaver, Garfield, and Kane counties. So we have a large rural area. We appreciate you joining us to talk about projects and pathways and partners. Sean, did you want to introduce yourself now or?
Yeah, sure. I'll do that real quickly. I'm Sean McMillan. I'm the Executive Director of First Step House. We're a community-based behavioral health service provider located in Salt Lake City, Utah. And I want to thank everyone for joining us on a Friday afternoon and one of the last panels. So thank you so much.
Good. So I'm just going to go ahead and start to share with you. Give me just a moment. So as Sean and I sort of talked about our session and where we each sort of fit in the picture, it was really clear that I am on the more infancy stage of projects and pathways and successful programs. So I wanted to be able to share with you the things that we've learned just in the last 4 to 5 years, which has been uh, a, a big growth period for the Iron County LHCC. So, just a little bit about Iron County. Iron County is about 60,000 folks. Cedar City represents about 40,000, and our poverty level is really high. So, out of 29 counties in Utah, we now sit at about, I think, fourth from the bottom. And one of the things that is always a challenge and an opportunity for us is Iron County, Cedar City in particular, we have a gorgeous exterior. Obviously, you can't argue with the national parks so close by, the views in our own town, a beautiful main street. And so we've got this great exterior, which then just means the more gorgeous it gets, the more we have to educate. So that is a large part of what we do. Because in rural Utah, and especially in Iron County, homelessness is not prominent, it's not visible. We don't have tent cities on Main Street. So it looks different. And more often than not, it's that it disappears. And so, again, we have to educate, educate, educate to let people know that poverty is an issue, homelessness is an issue, um, hunger is an issue, domestic violence. We still have all of those things in our town that we need to take care of folks on. So Beaver, Garfield, Iron, and Kane counties, that's about 18,000 square miles. And it means that we have to get a little creative. That's a large space of rural Utah to cover, but that's where partnerships really come into play. The LHCC, the Iron County LHCC, had this great history of passionate people that wanted to be partners, but we're still in that handshake partnership uh, part of the relationship. And I think the LHCC was in a putting out fires mode. And the lens was really organization by organization. We didn't have a holistic picture, but still doing good, still functioning. But I think we've grown so much in the last 4 to 5 years, like I said, which have brought then greater possibilities to our location and more successful um, programs. So, as I made the comment, we had a good bubble going on. We really thought, we're in the game. We got this. Nobody has to be doing better than us, right? This is how you do this. But we were all so willing, and I think that's the first thing that I realized. all of our partners had the desire to get in this with us. And really, we just needed some way to make that happen. So your heart's in it, but we needed to know how to organize ourselves. So Iron County Care and Share is an emergency homeless shelter, essential services and wraparound services, day shelter, and a food pantry. And a large part of what we dug into, I dug into, was advocacy, education, and fundraising, and doing it along with our LHCC. Even in a small community, telling your story and building partnerships is so important. And I would argue might even be a little bit more because it's not traditional. And so we really need to have sort of the team that's in it, the LHCC collaboratively working with the community. So when I first joined Iron County, just about 5 years ago, I received a call one day from Vecino. Vecino is a supportive housing developer. They have amazing projects. And they said, we'd like to build some senior housing in Cedar. And I said, could we just maybe not senior right away? Could we talk about the other things that our community needs? And so immediately we got swept up in this partnership. It was absolutely amazing. I'll be honest, I didn't know what the heck was going on, but I was along for the ride. And when I brought the idea to the LHCC, everything was really well received. Then we got this 80 unit community they call Libertad. We had to make sure we stayed aligned with the LHCC because we really needed our partners, and we really needed our partners in the state as well. And then we just really concentrated on continuous improvement. So that project really sold why we needed to be aligned. It was this amazing project. And I don't know if you've ever been to Cedar, but the 80 units sit just south of our city golf course. So, an amazing location. The views cannot be beat. But as you can imagine, we needed almost immediately before the property was even closed on, we needed to start our education. And we needed to figure out how do we share the message and in what formats. So we reached out to partners. So the city golf course, golfers individually, law enforcement, city council, those are pretty traditional. But then we reached out to Bikers Against Child Abuse and Combat Motorcycle Veterans Association and the Interfaith Alliance. And those non-traditional ones, non-traditional partnerships have been really beneficial. We were able to bring Combat Vets Motorcycle Association out to the community and to help us talk to vets that were in a house with a roof over their head for the first time in lots of years. Obviously, we reached out to our healthcare providers. Another non-traditional that we did is we have a spot in the middle of town that we call Burger Row, and it's really one of the 3 exits into Cedar, sits right in the center of town, and lots of traffic. And we also know that's where many of our homeless friends find first and congregate. And so I think having good relationships on that pathway with food folks made a big difference. We work with the BLM. So BLM came to us and said, we're finding families really far out of town. What are we supposed to do? We started community outreach programs. We created some welcome to our community cards that has information about domestic violence shelter that's in town, our shelter, our case management, our food pantry. We stuck the suicide hotlines on there just to make sure that we were, sharing resources for folks. So again, traditional ones like higher ed, reaching out to SUU. SUU Nursing Department is now joined with us on our outreach program. And so we're really excited about that one. We have on-site education and care. We have a family navigator on site. That's our partnership in that relationship. And we bring education to the community. So holding basic finance classes, bringing in a local landlord to talk about how to be a good tenant. And what does that mean when you've got to support yourself under a roof for the first time? And we have crazy bingo nights, the same thing. And we are blessed with a local property manager who is on our board who gets it. And it's been some of the only relief we've had in housing because of the lack of availability. And that property manager really has saved our hide in I can't tell you how many ways. The second thing to dawn on us was that we needed foundation in all of this. And in all honesty, we have to thank the folks in Housing and Community Development in the Homeless Programs Office. Uh, they they take care of us, and we are so grateful. And they have grown with our organization and seen us go through some transitions. And having that foundation, having then the state strategic plan on homelessness, just to give us a little framework, our LHCC required activities that we're all really diving into right now. Those things give us sort of a level playing ground with our community. Um, I don't know about you, but going to an LHCC meeting and start talking about the strategic plan and a VI SPDAT and what this means and assistant performance measures, those two things are giving us plain English to start to share with our community, and they understand what the data is telling us, and we work on that consistently. The other thing I discovered is no matter how much I think I'm in a silo, we are not, I am not, we're not in this alone. And we hear from our partners and our peers, and we're so grateful. So the next part is really staying in that maintenance, staying strategic, focused, bringing in community engagement, and always asking ourselves, are we? Thinking of out of the box solutions, we are not afraid to get weird in the Iron County LHCC. Maybe it's just me, but I think we're in it together. Iron County Karen Chair has an annual, it's going to be fifth now, charity dodgeball tournament. So, as you can imagine, in a town of well run golf tournaments, which are amazing for fundraisers, we've now kind of dug into the different and the next generation. And we try to focus some of our partnerships the same way. Making sure our community comes first. Change, as you know, requires buy-in, and we've got to get the education out there to have the support from folks. Collaborating traditionally and non-traditionally, looking at the gaps in our collaboration, which is, we have to do that consistently, and looking at the gaps in services in our community as well. Might be strange to promote a session that happened yesterday, but I know we're all going to have access to the recordings. Please, 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 if you didn't attend the session or you missed out yesterday, the session about reimagining your LHCC through community engagement, it was Danielle Stevens and Jess Lucero. It was an amazing session, and I think it helped take my brain to the next level. Again, I mentioned we're really in the beginning stages. We're just learning to walk, maybe trot a little bit. And then I think the beauty of our conversation today is that Sean's going to show you sort of what it looks like when your partnerships really flourish and come to fruition, and what projects you can develop utilizing partnerships. So again, check out that recording of that session. Everything is possible. We can do this no matter what our heads say to us. But we have this really unique and amazing opportunity to be bringing our community through our LHCC, through all those partners, into meeting the needs of our growing communities. And so I think we're in an awesome place. I try to remember myself of all that all the time, to be grateful, and that the hard work pays off. People just want to know how to help us, and that's where developing your friendships and your partnerships is really important. And you will survive if you go a little weird. I'm here to tell you that you can absolutely do that. So I hope you'll see in Sean's information how well you can do, and I'm excited for him to share this program with you. So I appreciate your time. Thanks so much. And it's all yours, Sean.
make it happen. Is my audio on?
Not yet.
Okay.
There you go.
Okay. So again, thank you, everyone. I'm going to talk about our two projects. One is Central City, and this is located at 434 South, 500 East in Salt Lake City. Those of you who live in Salt Lake will recognize the Smith's grocery store, the large Smith's Marketplace grocery store on between 4th and cursor is a 72-bed residential treatment facility. We serve veterans and individuals from the community at that location. Then this is our Central City Apartments project at 434 South, 500 East. And then this is our project that is under construction, 426 apartments. So they're right there in a row. This is across the street looking west from the Smith's Marketplace. So let me tell you the story of how this all happened. First Step House first is we're a behavioral health services provider. We have our deep roots in Salt Lake City, Salt Lake County. We were founded in 1958. When I say behavioral health services provider, I mean individuals who struggle with a substance use disorder and co-occurring mental health conditions. To meet the needs of the population that we serve, we've developed residential treatment services, outpatient treatment services, robust case management services that in many instances are time unlimited. We've also developed transitional housing, or more specifically, it's recovery housing. And we've been doing those sets of services for, well, in the residential treatment space for 30 years. The outpatient service 20, case management services 15, or the recovery housing for 20 years. So we had experience with housing, but transitional housing. We had experience using community resources, home dollars,